Well, first, good morning. I want to say a few words about the ongoing effort to bring home the hostages. And Hamas has been holding since October the 7th. We've been working on this intensively for weeks, as you all know. I've spoken recently about it with both the Prime Minister Netanyahu and the Emir Qatar. And my team has been in the region shuttling between capitals. We're now very close. Very close. We could bring some of these hostages home very soon, but I don't want to get into the details of things because nothing is done until it's done. And we have more to say, we will, but things are looking good at the moment. Now, we're here today to talk about fentanyl and how we can do more to save American lives. Fentanyl is likely the number one killer of Americans aged 18 to 45. And it's an issue that's hurting families in every state across the nation. And curbing this crisis is something that every American can get behind, Democrat and Republican. That's why tackling this opioid epidemic is part of my unity agenda. We're working intensely to address this threat from every angle that we can pursue. Our administration has taken historic steps to expand access to life-saving public health services and break down long-standing barriers for treatment for substance abuse disorders. We focused on prevention, harm reduction, treatment, and recovery. That's been our focus. But this challenge also has roots outside our borders, outside the borders of the United States. It's a global challenge that demands global action. So we're pursuing strong international coordination to strangle the flow of these deadly drugs, as we are doing with precursor chemical ingredients and pill presses used to produce these drugs. Last week in San Francisco, we made important progress with both China and Mexico to strengthen our efforts to address this scourge. During my meeting with President Xi, we took a critical step of resuming counter-narcotics cooperation between our two countries. It was one of the important things we agreed upon. In 2019, China essentially stopped direct shipments of fentanyl from China to the United States. In the years since, the drug trade has evolved. It's moved from finished fentanyl to fentanyl components, like chemicals and pill presses, that are shipped with few controls from China to the Western Hemisphere. Chemical cartels use these components to manufacture these illegal substances and smuggle them into the United States. So the United States is going to seek to work together with China to target the fentanyl components. As a result of our recent diplomacy, China has already taken steps to shut down companies dealing in illicit trade of precursor chemicals. We're now, we're not just going to trust that this is happening. We have to verify it. And that's going to save lives, we believe. While in San Francisco, I also met with the President of Mexico. Together, we committed to expanding law enforcement cooperation and intelligence sharing to better disrupt the flow of fentanyl and dismantle the violent chemical groups that traffic synthetic drugs in our communities. We've made record seizures of fentanyl at the border this year, intercepting these dangerous drugs before they can get into the United States to do the damage they do. We're working trilaterally with Mexico and Canada to quickly share information on drug trafficking trends and threats, and in July we launched the Global Coalition to Address Synthetic Drug Threats, bringing together more than 100 nations and international organizations to tackle this challenge from every possible angle, preventing illicit drug manufacturing, detecting emerging drug threats, disrupting illicit financial activities, and to enable this deadly trade to continue, and expanding access to evidence-based health services. We have so much more to do, though. We're not kidding ourselves. I called this meeting to make sure we're doing everything we can to keep building on the momentum of last week. How can we accelerate our efforts and make sure that we're delivering real results for the people that are being hurt so badly? Congress also has to step up in this fight. Start by passing my supplemental budget request for national security priorities, including significant resources to help stop the flow of fentanyl into our country, as well as funds to strengthen support services for people struggling with fentanyl impacts. Look, I also urge Congress to permanently make fentanyl and related substances Schedule 1 drugs, and to take that action to help limit the distribution of pill presses and close the loopholes that exist now for small shipments of fentanyl. And there are many of those loopholes. As families all across the country gather this week with their loved ones for Thanksgiving, too many are going to face looking at an empty chair for the first time at Thanksgiving, because so many people have died. That's heartbreaking. It really is an American tragedy. Just in the neighborhood I'm in, next door neighbor, anyway, just tough stuff. People are dying, and I'm committed to doing everything in my power as president to get this crisis under control. So we're gathered today here to get to work together to make sure we're coordinating all our efforts in each of the agencies to make progress on the progress we made with both AMLO as well as SHE. So thank you very much.
Mr. President, how many members